For women who have a pre-existing diagnosis of diabetes going into pregnancy, it's really critical that their blood sugars are well controlled before they get pregnant. Not only is it important for their physical health, their cardiovascular health, and their whole body health going into a healthy pregnancy, it's really important in the early stages of pregnancy to maintain normal blood sugar levels in pregnancy. Higher blood sugar levels in pregnancy have been associated with outcomes including birth defects, heart defects. As the pregnancy continues, uncontrolled diabetes has been associated with complications, including babies growing very large, babies that may have difficulty passing through the birth canal, which can create an emergency known as a shoulder dystocia, or a baby could get stuck. Sometimes babies are too large to fit through the mom's pelvis, and we end up needing a cesarean delivery. The other challenging aspect with diabetes in pregnancy, particularly pre-existing diabetes, if it's not well controlled. The challenge with uncontrolled diabetes heading into delivery is babies become used to having high blood sugars. So their bodies produce an extra hormone called insulin to control those blood sugars. But once the umbilical cord is clamped and cut, the baby's no longer receiving extra glucose, but they're still producing high levels of insulin. And that can cause babies' blood sugars to drop. When babies have low blood sugars, it's called hypoglycemia. And those babies sometimes need extra support by supplementing breastfeeding with formula feeding or glucose gel. Sometimes those babies end up in the special care nursery because they need IV fluids with sugar to maintain their blood sugar levels. Our goal is always to keep families together whenever possible. And so optimizing blood sugar control going into pregnancy, and especially pre-pregnancy and delivery, are critical to keeping families together and keeping them healthy. For babies born to diabetic mothers, it's really important that initially we're making sure that babies' blood sugars are staying elevated. During pregnancy, babies' insulin levels are high because mom's blood sugar levels tend to run high. The better the blood sugar control of the mom, the better the blood sugar control of the baby. But in cases where blood sugars for the mom are not well controlled, we can end up in situations where babies have very low blood sugar after delivery, and sometimes they need extra supplementation with glucose gel, or sometimes need supplementation with formula, or sometimes are admitted to our special care nursery for IV fluids with sugar in them to help maintain their blood sugars. It's going to be important to monitor that as babies go home. There's also an increased risk of jaundice, which is a buildup of bile acids that can cause yellowing of the skin. So it's really important that parents pay close attention to how their babies are doing. Are they behaving the way that they were expected to? Do they seem sluggish? Do they seem sleepy? Are they feeding well? Are they making plenty of wet and dirty diapers? And then having close follow-up with your family medicine provider or pediatrician after the hospital birth or a community birth to make sure that baby gets immediate care is essential. Forming a good partnership with your healthcare provider when you have pre-existing diabetes prior to pregnancy, or if you're diagnosed with gestational diabetes, is really critical to having a healthy outcome to your pregnancy. First, it's important that we keep the mom healthy by maintaining her blood sugars at a normal level. We want to make sure that maternal weight gain is within the recommended ranges, so women do not have a huge weight gain that they then have to lose postpartum, which can contribute to increased risk of type 2 diabetes, cardiovascular disease, and obesity if not addressed promptly. It's also really important for baby, both to control blood sugars around the time of labor and also delivery to prevent admission to the special care nursery, potential prolonged hospital stay. It can also prevent complications related to delivery, complications such as shoulder dystocia or baby not fitting through the birth canal or getting stuck on the way out. It can also be a reason that we need to go to a C-section if we have a baby that's much larger than anticipated because of uncontrolled diabetes. And preventing the first cesarean delivery is particularly important to healthcare providers so that we can optimize women's outcomes for their future pregnancies. Some women will need medications to manage their diabetes in pregnancy, and that's true for type 1 diabetics, type 2 diabetics, and sometimes for women who develop gestational diabetes from their pregnancy. During pregnancy, the placenta grows larger and larger, both to sustain growth for the baby, but it also secretes hormones that make women insulin resistant. And insulin is a storage hormone that helps our body take sugar from the bloodstream and store it in our cells. Babies, however, like constant access to a buffet of sugar to help them grow. So the placenta works against women in a lot of ways who are trying to control their diabetes. That's why so many women end up on medications or need their medications adjusted during the course of their pregnancy. That's why partnering with a prenatal care provider who is well-versed and experienced in the management of type 1, type 2, or gestational diabetes in pregnancy is critical to having a healthy and successful outcome for your pregnancy. It's also common that after delivery, that because the placenta has been delivered, we often see blood sugars decrease very quickly. And a lot of women who were on medications may not need those medications or may need much lower doses of medications to prevent complications such as low blood sugar or hypoglycemia. Another potential complication related to gestational diabetes is when women are diagnosed with gestational diabetes in pregnancy, they have an increased risk of having gestational diabetes in a future pregnancy. Even amongst women who don't have a future pregnancy, there's an increased lifelong risk of developing diabetes for those women, and that's been estimated to be anywhere from 30 to 70% of women. So it's really critical that all women be screened for type 2 diabetes at their postpartum visit if they've had gestational diabetes. And it's also essential for all women who have a history of diabetes during a pregnancy, whether it was type 1, type 2, or gestational diabetes, to have annual follow-up every single year with their primary care provider to manage their chronic medical conditions and to be screened for diabetes. Receiving a diagnosis of diabetes during a pregnancy can be very scary for a lot of families. This is a condition that not everyone deals with every day, but it's a condition that we deal with every single day. We partner with multiple teams to ensure we optimize outcomes individually for every single patient and that those treatment plans fit within that patient's lifestyle. We use nutritionists with special education on diabetes diet for pregnancy to help women make good, healthy meal decisions to help minimize changes and fluctuations in their blood sugar. We also add medications if they're needed to keep blood sugars optimized heading into the late stages of pregnancy and delivery, as well as the postpartum period. We also partner with specialists from Fargo called Maternal Fetal Medicine, who help assist with the management of high-risk pregnancies complicated by pre-existing diabetes to rule out complications such as congenital birth defects or heart defects that are a consequence of uncontrolled diabetes going into pregnancy. We also work together to monitor baby's growth throughout the pregnancy by following with ultrasounds regularly. And then we individualize the timing of recommended delivery based on how well mom's blood sugars are controlled and any other chronic medical condition that she may be dealing with during her pregnancy.